Hi, everyone, and welcome to the Clinic Scripts podcast, where we explore how technology, especially AI, is shaping the future of mental health care. I'm Stacey from Market Tech, and today I'm joined by a special guest whose career truly embodies what it means to be a lifelong learner and educator. Dr. Sandra Nite is based at Texas A&M University, where she's worked across multiple roles, including with high-performance research computing, the director of teaching quality grants, and the director of AP Summer Institution in mathematics and computer science. She has over 15 years of experience in STEM education, and most recently, she earned her master's in mental health counseling. Congratulations. Today, we will be talking about the transition, how her STEM background influenced her views of counseling, and her early thoughts on the role of AI scribe tools in supporting mental health professionals.
Thank you for having me.
We can start with your story. You've had an incredible journey in education and how you've stepped into the world of mental health counseling. So, what inspired that transition, and how has your STEM background shaped the way you approach counseling so far?
Yeah, so I'll give you a little bit of the background then from the beginning of my career, basically, for me, I never had like a career path I had always planned to exactly do, which is fine if you do, but for me, it was when opportunities came up, I took them for learning more and doing more. So I started, in teaching mathematics, and I taught at the high school level. And I felt like my goal and my role there was to help students prepare for college, because the math background is really important in so many fields, and students would find out they didn't have what they needed to go in the field they wanted to, and it would have to take something else that was not what they really wanted. So that was what I wanted to do, and that's what I did for a number of years. And I started a computer science program in the high school in very early days, and some of that also involves AI. So I'm not an AI researcher, but we do a little bit with AI in our camps, and so I know some things about AI and how it works in general terms. And so I got the opportunity. Then I've kind of been watching what's happening with that, and seeing what was happening in the field, and looking at the chat GPT and different things to see how it's going, and have a lot of concerns about some things, but also see some great opportunities. But to get into the mental health counseling, then what happened was experiences with extended family members and coworkers, and seeing as the need grew and grew in that field. And then after the pandemic, during and after the pandemic, it got a lot worse. And so I looked at that and I said, I think I could help. And I thought, here's another area where I could help. And maybe it's even more important than the work I have been doing. And I felt like I had the ability to do it. And so I decided to start my program in October of 2021. And then I graduated this past December, and then got my license in January of this year. So I'm still working in high performance research computing, but also doing some counseling. And my plan was for that to be my retirement career, not really as such, because I don't want, I'll have a retirement. I don't want to charge a lot of money for people. I just want to help people a lot. And so I'll be able to do like very low cost. So that's how I got into counseling. It was really about, how can I help people? And I felt like this was a field where I could help, and there was a need. And so that's how I got into that, and having a little experience with people who were having some issues more closely, interested me in that field. So I decided to give it a whirl and see what I could do. So AI, I've been watching it, and I'm not fully ready to really incorporate AI into everything, because I know this idea that AI can be smarter than humans and do all the things. If we don't even really truly understand how our brain works, we can't program something to do what your brain does. So we're not there by a long shot. So there are those limitations, but there's also a lot of usefulness to it. I also understand about training models. They can be trained in a biased way. So you have to be very careful about that kind of thing as well. We've seen that already in our world. So we know this happens. But there's also a lot of use for it, as you well know. That's kind of how I see AI in general, about how it can help us think. AI script. Is that what it was? Okay. I don't know a lot about AI script, but I saw a webinar recently a little bit. I learned a little bit about it. And looking at that is a tool I know that is for medical professionals, and so some mental health counseling, and does a lot of other things as well. And I don't know all the details because I haven't used it. But what I do know is that that can be very helpful. Beginning counselors, there's a certain way that you usually write your notes. So there's sections of the notes that you write in counseling and the treatment plans and all of that that you design. So someone could put the information in, but they don't fully understand in the beginning exactly how you parse that out for the different fields that you need to put in your system. And that's, I think, one place where something like that can help you, because it can help someone who's new to figure out, okay, this belongs in this area. This is about a presenting problem.
Yeah.
This part is about the treatment. This is about the homework assignment or the, that you're going to give them. This is about the assessment. These are the different parts. And this is how the treatment plan can look. So you can have this information and not fully know how to organize it. And that's a place where it could be really, really helpful, I think. That can really help beginning counselors.
Yeah. Well, like that's the kind of use case we love exploring, where like the technology isn't replacing clinical thinking but supporting it, especially during these early learning curves. And on that note, I'd love to hear your thoughts on the bigger picture. Like, you've made a major career shift recently, and you've also watching AI begin to reshape both education and healthcare. And what would you say to someone, whether it's a new counselor or even a seasoned professional, like, who feels hesitant about AI entering this space?
I think it's a good thing. I think it can be very helpful. It can save you time, and time is money. Counselors have to spend time outside of counseling sessions preparing and all of that. So I kind of touched on this before, but there's sometimes we have a base of knowledge, and we have different things that we share with clients. We have diagrams and different things like that. And yeah, you might forget about one you haven't used in a while, or experienced counselors, and you're like, oh, I remember that. Where's that one? And you can do a search in your materials for it with AI, with not having to look through everything, because who knows what you titled it. But if AI can actually look at the content, and to figure out, because it has to be able to, actually see the content of it. And when you're searching for something, it's not always looking at the content of the documents and things that you have and the figures and stuff like that. So if it has ability to do that, could be really, really helpful. So the things that were talked about too in the webinar about using the diagnostic documents and having AI help you. As a counselor, you can't remember every single thing in that very long document. So sometimes you might not remember something, and it's a long time to look all the way through it, and AI could help you really to find that. So that could be really, really helpful just in the diagnostic end of it as well. When you have something that's a little different from the usual things that you do counseling for, and you're like, oh, it seems like different. I remember these recording a session and having it transcribe and then pulling my notes from there. But, and AI could pull the notes from there. The problem I have with that is I'm not sure about a system that would be very secure for even storing temporarily a recording of that level. And I think that clients might not be comfortable with it either. Because we know that even if it were to take the notes and then you delete the recording, fully deleting something we know is very difficult. Things still stick around online when you think they're gone. So I'm not totally comfortable, and I don't think that clients would be totally comfortable with that. It would be great if you could do that, right? So that's an area that could be really useful, but is probably not practical, and even border on being unethical in some situations. I mean, you have to have signed consents and all kinds of things for that, which you're not likely to get too often. That's something that AI could do that we'll see, because we do have to be cautious. We have to be concerned in counseling about ethics. There's a lot of things in regard to that, so we don't want to ever violate any sort of privacy, confidentiality, keeping things secure, knowledge very secure. So those are things that are important. So those are things I think, for beginning or even experienced counselors, that we can look for the future, ways that we can use AI to help us be better counselors. And then I think you were asking me something about a lifelong learning journey. And I would give this advice.
Okay.
My advice to people, whatever age they are, is always to be open when you see new things you can learn about that you might be interested in or could be useful. A lot of people nowadays change careers. I didn't really look for that change as I was going on my journey. I just went into things I saw that were interesting. But I've used everything in everything that I do. If you think about it, what I've learned in counseling helps me also relate better and work better with people in my career, in my regular work. And my background in computer science and math helps me in my counseling and in education in general. Because in general, in education, teaching high school for 15 years, 17 years really, because I taught a couple years in the private school too. You have a lot of students that come to you for a lot of reasons.
Mhm.
You do actually a lot of counseling as a high school teacher if the students trust you.
Yeah,
And they help.
very important.
Yes. I mean, I've even had some come to me and say, you're better to talk to than our, school counselor, And so everything, all the experiences that I've had play into everything else. So everything that you do, everything that you learn, remember that it's all can be used. You just have to, figure out or think about how can I use that? Sometimes you don't even notice it
Mhm.
that much, but I know I use things I learned in mathematics. I learned things I did in music. So I've actually done some research in music education as well as research and evaluated on grants and things like that in the music world as well. So I've done something on everything, every degree that I've gotten, I've used its purpose, but also it's played into everything else. It comes in useful so many times. So now I'm doing counseling. I can recommend certain music to help people, to help them be more uplifted, right?
Yes.
They, what about this? What if in the morning when you get up and you're feeling down, what if you sang, or what if you listened to some kind of music? What if you need to calm down? What if you can, classical music, some of the instrumental classical music. I'm a Mozart fan. Because music is very, very powerful. We know that. So I haven't studied music therapy as such, but just knowing about music can also play into that. So I would just say learn everything you want to learn about everything you can and use it. And who knows whether you'll take another path to another career, but just use everything and learn things new. And whatever you see coming along, learn about it, read about it, take a course. I do degrees because then it forces me to go ahead and keep learning about it and not like put it on the back burner.
It's clear that everything you've done, whether in the math classroom, summer camps, teacher development, or now counseling, is all connected by its sort of showing up for people. And what you just said really summed it up. Like even before the formal title of counselor, you were already doing this job, like listening, supporting, and being the trusted adult. It's such a great reminder that every stage of our career adds up, and embarrassing something new, like the counseling or even AI, doesn't mean starting over.
Right.
It means it's more like meaning the building on everyone you've already done. So yeah, Sandra, thank you so much again for sharing your journey and your reflection and your vision for how technology might support the next generation of kids. So it's been a true pleasure having you.
Thank you so much. I've enjoyed it.
And that brings us to the end of today's episode. Dr. Sandra Nite reminds us that innovation doesn't erase experience, but it builds on it. Whether it's decades of teaching or brand new chapter in counseling, every part of the journey matters. It might be reshaping mental health care, but voices like Sandra's remind us that human connection, reflection, and adaptability are still at the heart of it all. Thank you so much for listening to the Cleaning Scripts podcast. If you're enjoying this episode, don't forget to follow us for more conversation at the intersections of mental health, technology, and the people who bring them together. Until next time.